This segment of DelmarvaLife is sponsored by TidalHealth.
Not only is February Heart Health Month, but this week in particular is Cardiac Rehabilitation Week. So, what does that mean? Well, if you had a heart attack in the past, it's important to discuss the recovery process and tips on preventing it from happening again.
But it's just as crucial to understand that you have the power to take cardiac health into your own hands by seeking help from the proper professionals. And we have one of those professionals right here in historic Studio D. This is Dr. Rick Simons, a cardiologist at TidalHealth. Thanks for being here this afternoon.
My pleasure.
Good to see you. Okay, so why is Cardiac Rehabilitation Week so important?
Well, it's important to positively affect the disease process. So you have atherosclerotic changes in your blood vessels that unfortunately have caused a heart attack or a stroke. That disease just didn't happen overnight. It took decades to develop that type of plaque, and then the plaque becomes unstable at a particular time and moment, and then the heart attack and stroke happens. We have to, hopefully you've survived your heart attack and stroke. Now we have to affect the disease process so it doesn't continue, doesn't cause more heart attacks and strokes. So we can, fortunately, there's a lot of science behind the disease process of atherosclerosis, and we can get in there and affect how that disease progresses in the future. So with a combination of diet, exercise, and medications, we can actually suppress plaque growth and help you stay healthier for longer.
Ooh.
Wow. So is it really that, I mean, it's a rehab program. You got a cardiac patient. Is it really that simple?
Simple to say, a little more difficult to do, but a combination of a healthy diet, a Mediterranean-style diet, with exercise program.
Right.
And we generally recommend a combination of aerobic exercise and strength training, resistance training.
Yeah.
That in combination with diet, again, helps everything. Helps your gut microbiome, helps your inflammatory markers, helps your blood pressure. We also have good medications. I mean, there's good, powerful cholesterol-lowering medications. The foundational medicines are statins that help lower your cholesterol, help prevent plaque growth, help stabilize the plaque you have. But there are newer medications out now. We have injectable medications that, in combination with statins, really profoundly lower your cholesterol. So we have some tools in our toolkit nowadays that we didn't have in the past. We also have a better understanding of how plaque grows and how it manifests.
So let's back up a little bit. You know, you're talking about rehab. Let's go back to someone who may not have ever had a heart attack before. What are the symptoms that you may be having a heart event?
Well, the signs and symptoms of a heart attack are variable, and that's where it gets tricky, because your heart attack symptoms are going to be different than mine. Women have a tendency to have more atypical symptoms, but in general, symptoms of a heart attack, some uncomfortable feeling, pressure, tightness, squeezing. Some people say it's an expanding. Some people get it in their throat, their jaw. Some people get it in their shoulders, down their arms, upper back. So there's a lot of different symptoms, but the bottom line is, if you're having a symptom that's making you very uncomfortable, causing some sweating, some short of breath, you better not think about it too much. You better activate the EMS, get yourself to the emergency room, get evaluated, because the timeliness of the evaluation is important. You don't want to wait till the next morning. The heart attack's done, the damage is done.
What you're saying, prevention's the best thing.
Absolutely.
So how can we effectively get the word out about heart health?
Well, we can do shows like this.
Yeah, okay, all right, right.
But I think they should teach it in schools, to be honest with you. At least the basics of a Mediterranean-style heart-healthy diet should be taught to kids, and some of the science behind it.
Yeah.
I mean, the fiber content of your diet is important. What do they do with processed foods? They take all the fiber out. The fiber is critically important because the fiber is what causes your gut microbiome, the bacteria that live in your gut, to form what's called short-chain fatty acids. These short-chain fatty acids have amazingly wonderful effects on our body.
Yeah.
They help our gut health, they help our liver health, they help our glucose metabolism, they help our blood pressure, they help our cholesterol, they even help our brains. If you get everyone on the right path early in their childhood years or preteen years, and you adopt that as your normal lifestyle,
Then
hopefully you don't get
there
vascular
you go.
disease.
That's it.
Dr. Rick Simons, TidalHealth, thank you so much
Oh,
for
you're
coming
welcome.
in.
My
We could talk
pleasure.
about this for hours.
No
Woo.
kidding.
Yes.